Okay. Welcome to my second episode of my second season of my Lunch and Learn video series. I'm Amelia Maddox. I'm a doula and health educator in Greensboro, North Carolina. And today I have Erin Balkin. She is a cranial sacral therapist. And I really want Erin to tell us a little bit about what that is and what you do.
Yes, it's a mouthful, as my daughter will say. So cranial sacral therapy is a pretty subtle, more energetic, on the energetic side modality from body work. However, it is very tactical, tangible. I'm listening to the cerebral spinal fluid as it's moving up and down your spine. Sorry about that.
That's okay. Phones ring.
Phones ring. I'm working with bones. I'm working with muscles. So I'm working very tangibly. However, it's very subtly at the same time. So it was founded by an osteopath about 100 years ago, 150 years ago now. And he discovered it by experimenting on himself, where he would tie off his head and do different spots tight and see where he felt it.
Oh, interesting.
And so he really self-studied and then studied for years and years and years with clients and developed this whole amazing intelligence system for to study from the body. So yeah, in a session, I'm waiting and listening for what your body already knows it needs to do and helping facilitate that process.
Okay, so tell me what maybe if I came in for an appointment, what would that look like? What would an initial appointment look like?
So with an adult, it's going to look very different from what a baby session would look like.
Oh,
so
okay.
I'll give a quick on an adult, and then we can talk more about what babies would look like. But,
okay.
So an adult, I'm going to get some background, find out why you're coming. Depending on why you're coming in, I'll take an in-depth history with that for guidance.
Okay.
Like I don't need to know every surgery, everything. Usually people are coming in for something pretty specific.
Okay.
So we'll track origins of
so
that.
like pains,
migraines, insomnia, irritability, car accidents, lots of whiplash.
Oh, okay.
Any sort of traumatic event. So once we sort of figure out what you want to work on, then we get you on the table, you stay fully clothed, and most sessions run about an hour. They can run a little bit more, is me with various handholds. So I usually hold at your head, I hold at your feet, I'll hold at your sacrum, the triangle bone at the base of your spine, in your hips, and all the while I'm listening for the tidal motion of the cerebral spinal fluid and listening for how everything relates to that motion. So bones, muscles, organs, all of those things have their own fluid motion within in relationship. What I'm listening for, especially if you have, say, chronic headaches, I'm listening for the aberrations to that movement, that I know what it should feel like, and maybe it's moving more in a direction, or it's not able to move.
Like maybe it's stuck.
It's constricted. And then that's where we work.
Okay. So what about, so the reason why I brought you here today is because you do work with babies, people who are pregnant, and families.
Yeah.
And so what are some of the things that you can do for babies?
So a baby session is going to look a lot different. I call it baby time when you come into my office, because babies definitely operate on a much slower pace than we all do. I'm going to take a very in-depth history from sometimes conception, preconception, through gestation, how the birth was. I'm going to ask a lot of questions. I'm going to ask how nursing's going, what, just reasons and why they came in, like what the concerns are and what brought them in. Often people are coming in for torticollis, which is like a baby's head.
When it's a little tilted. Yes, I had 2 children that had that.
Yeah. Tongue tie is a very popular reason for coming in.
Okay.
Both before and after the revision. any sort of plagiocephaly, like the flattening of the head,
Okay.
colic, basically anything that we go, oh, that's just a baby being a baby. While we've normalized that, one of my instructors is, I love her quote of, just because it's normal, or no, just because it's common doesn't mean it's normal.
Ah, interesting.
And so those are things that we don't have to just suffer through, or the baby doesn't have to suffer through just
Right.
because it's a baby.
Right. Like lots of babies have colic.
Yes.
And having had a baby that had colic, it is awful
Yes.
for everybody involved.
Yes.
And nobody's getting much rest, and so you do want to do as much as you can
Yeah.
to help relieve that, because maybe the baby's maybe they're not in pain necessarily, but something
is going
on. Is upsetting them.
Yeah.
And it's causing everybody a lot of stress.
Yes.
So that's
Yeah.
that's so cool that someone could come see you
Yeah.
for that, because that's a very common
It is.
issue.
It is. And so once we get through all this history in a session, body work with the baby, they're really just this sack of connective tissue at this point, right?
Yeah.
And so they don't like to hold on to anything. And if they realize that, like, oh, that feels better this way, they just automatically start doing that.
Because they haven't formed the habits
No,
that
they
we
haven't.
older folks have.
Yes. The years of baggage are not there. So they tend to resolve really quickly. And with babies, it's a lot more of just allowing their body to come into full range of motion, full decompression. Birth is just a naturally compressive process.
Oh,
Yeah.
obviously.
Yeah,
yes.
they got to get out.
Going through the birth canal.
And even, C-section has its issues
Of course.
with pulling, or, how a baby was maybe stuck in utero. So all those things, you just kind of help the baby to come back into alignment and let go of all those things. And sometimes they have a lot to say about it. So we always work within everybody's comfort level.
Sure.
On that one. Try not to have too much on the crying, but sometimes they really just need to know that they were heard. And so that's a huge piece of what I do, is really like that, letting that story and their story unfold and be told and be heard by everybody in the room. Ideally, we've got mom and dad. Sometimes it's just mom or mom and grandma, or
Yeah.
but whoever is there for that. Everyone wants to be heard. Everyone wants to know they've been seen.
Absolutely.
And babies are no different.
Well, of course, crying is a form of communication. It's not just
Right.
what babies do. They do it for a reason.
Yeah.
Yeah.
So I also do some Bowen therapy, pediatric Bowen therapy, which is within the baby sessions.
Okay.
That really is helping to rehydrate muscles, and it's a more of an assessment, range of motion.
Okay.
Helping anything that is stuck to really open. And then I also send parents at home with some exercises and things that they can do.
Oh, that's great.
So yeah, it's, again, babies are so happy to not realize that they're not stuck.
Well, and my daughter had the tilt of the head when she was born, and we had some really excellent physical therapists that helped with that. And it was just so easy and a gentle way of getting her back in alignment.
Yeah.
And like you said, they're babies, so they're not so stuck in those positions.
Right.
It's a lot easier to kind of train it back.
It is. And a lot of times when they talk and are telling their story or reacting to something that you're doing, it's because they're so in the present that whatever you're doing is reminding them of the time when they were having that formed, and that they were uncomfortable. And so it's helping them come out of that and realize that they're not there. And so it's allowing for that differentiation as well. And that's where they get to come back to the parents and help with that bonding piece and that reconnect and and realize, oh yeah, I'm out.
I'm on the other side.
Yeah, I made it.
So what really inspires your work?
Babies.
I know, I love babies.
I know. I do love that they are just, they don't want to be stuck. They want to be happy. They want to show you they love you.
Yes.
And anything I can do to help with that process and make a family unit happier and more cohesive is, just makes me go, oh, I love hearing I had such a, the baby was totally different after, or I had my happy baby back after. Oops.
Oh. Front door, wind, blew the door open.
So yeah, it's amazing to be with these precious little beings that sometimes people, or we just throughout history, have put so much stock in. Oh, they're just babies, they won't remember. Or, oh, they're just babies, they don't understand. And no, they do. And they're so right there.
So true. There's so much research now, too, about memory and what, even though we don't have formed memories of our infancy, there still is memory there.
Yeah,
there's some really good
memory.
There's cellular memory, and there's some good research out now on how what happens in infancy and how it impacts us later on.
Yeah, I don't know if you've found the APA website.
No.
The Association for Pre and Perinatal Psychology.
No.
Yeah, it's a great website. We can talk later about that. But yeah, I mean, I bring all of that in to listening to the story and that awareness of everything gestationally and developmentally and all the stages where things can get hung up or breaks and bonding can happen, and it's nobody's fault.
Right.
But then how do you help make that repair, and that it's about the repair?
Sure. So do you have a success story to share? One of your favorites?
So anytime a mom says my baby either slept great afterwards or they were just happy afterwards, that's a success story.
Of course.
I think one of my favorites is I had a set of twins, and the birth was hard, and then went up into a C-section, and literally one twin was trying to beat the other one out. So
they were both trying to go at the same time.
Trying, and it wasn't working, and there was severe molding with the initial twin, the baby A, I guess at that point she would have been called. And within one session, I was fortunate enough to see her 4 or 5 days after birth.
Oh, wow.
And one session, and I didn't even recognize her. I had to ask which twin was which on the second session.
Wow.
So, it's pretty powerful.
That's amazing. Well, yeah, getting stuck in that birth canal can really change the shape of the head.
Absolutely.
And it can take some time.
It can, and it doesn't have to take a lot of time.
Right. Yeah.
So
it shouldn't take too much time.
It shouldn't. And I've had things resolve, 6-7 months, where all of a sudden they look totally different. So the head shape is not, set until, even I'd say 5 to 7 years old. But it gets harder and slower to affect the change.
Wow. That is so cool. Erin, thank you so much for being with us today.
Yeah.
And can you tell us how we can get in contact with you?
So probably the best way is my cell phone.
Okay.
336-209-4929.
Okay.
Text, call, leave a message. I will respond to all of it. Obviously, if you text, please introduce yourself, so I don't just wonder who that is. I do have a website, cbebodywork.com, and you can send me an email through that as well.
Fantastic.
There's a link for that.
Awesome.
So, but it has all of my information if anyone wants to read further on stuff.
Thank you. Thank you so much. This is so fascinating. I hope that everybody got a lot of great information out of it.
I hope so. I'm happy to talk about it anytime. So
thanks. Okay. We'll see you soon.
Bye.